Hello, my name is Cooper Duke with the Environmental Health and Safety Department here at OSU Stillwater campus, and today we're going to be talking about asbestos awareness. Here are the objectives of today's training. We're going to be going over what asbestos is, the different types of asbestos, where you can find asbestos, and where it's located, just some of the health effects of exposure to asbestos, some general housekeeping, and then asbestos spills. So asbestos is a name that's applied to 6 naturally occurring minerals, and these are mined from the earth. As you can see listed here are the different types of asbestos. Of those 6, 3 of them are found more commonly. We've got chrysotile, amosite, and then chrysotolite. As you can see on the left, chrysotile is white, and this is the most common type. Amosite is the brown / off-white color, you can see in that picture on the left, and then chrysotolite is going to be more of a blue color. And again, these are the 3 most commonly found asbestos. All types of asbestos tend to break into very tiny fibers. These are extremely small, and you have to use a microscope to even see these fibers. As you can see on here, the individual fibers may be up to 700 times smaller than a human hair. Just because they're so small, once they're released into the air, they can actually stay suspended in the air for hours or even days. And then another thing about asbestos fibers is they're virtually indestructible. They're resistant to chemicals and heat, and they're very stable in the environment. Asbestos fibers, they don't evaporate into the air, and they don't dissolve in water, and they don't break down over time. And asbestos is probably one of the best insulators known to humankind. It's very useful. It's used in over 3,000 different products. And usually asbestos is mixed in with other materials to form the products, so you'll find different percentages of asbestos depending on the product. And for example, floor tiles may only contain a small percentage of asbestos, but again, depending on the product, that percentage of asbestos may vary from 1 to 100%. So where can we find asbestos? It can be found in many different products and many different places. So in a lot of building materials, it can be in spray-on fireproofing, spray-on insulation in buildings, insulation around pipes and boilers, wall and ceiling insulation, black mastic, that's going to be your glue for your floor tiles, or that's where it's commonly found. And then equipment such as furnaces, kilns, and ovens that are designed to handle heat or high temperatures. Since asbestos is heat resistant, it's used in those kind of equipment. Here's some other places it can be found. It can be found in ceiling tiles, floor tiles, or mastic. The mastic is going to be the glue for the floor tiles. And then roofing shingles, brake linings, clutch pads, fire-rated doors. And these are all things that should be checked prior to removal or construction, especially with fire-rated doors, because not all of them can be marked. And then wall and ceiling texture in older buildings and homes. An example of a ceiling texture would be the popcorn ceilings that you see in older homes. That actually does contain asbestos before they phased it out. Some of the older homes with the older popcorn ceilings, that's going to contain it, or it might contain asbestos. Here's what asbestos signage is going to look like. And buildings that have asbestos-containing materials will have these signs posted near the main entrances, and this is typically going to be right where the fire alarm panel is. So ceiling tiles, asbestos-containing ceiling tiles are not going to be labeled or marked, and they're not going to look, you're not going to be able to tell visually that they're containing asbestos or not, so these have to be analyzed by a laboratory test. Here's a picture of spray-on insulation that contains asbestos. Here's some pipe insulation that contains asbestos, just an example of what that would look like. This is going to be an old ceiling. You can see the popcorn texture up there, and it's damaged, so that's whenever those asbestos fibers can be released into the air. And here's an example of some old floor tile, and it's very likely that this might contain asbestos in the glue that is used for the tile. It can also be in the tile itself. And here's another example of popcorn ceiling. And here's another example of pipe insulation that could contain or might contain asbestos. As you can see, this is kind of damaged. You're going to want to check on that so you're not having asbestos getting into the environment. You don't want to breathe that in. So like I said earlier, with fire rated doors, these are going to want to be checked prior to removal or construction. And like it says here, these may or may not be labeled. As you can see in that middle picture, it's pointing to the asbestos containing material. It's the insulation or whatever they're using on the inside. That just contains asbestos. So that's why we're going to need to check before we do any kind of disturbing to those doors. So now we're going to get into the danger of asbestos. It's very dangerous if you inhale it into your lungs. It's the most common way for the fibers to enter the body. It's through inhalation. And in fact, asbestos containing material is not considered to be harmful unless it is releasing dust or fibers into the air, which can be inhaled or ingested. So if asbestos is just sitting there untouched, unbothered, nothing's going to happen with it, or it's likely that nothing will happen. But as soon as you start doing construction or that material gets damaged, that will stir up the asbestos fibers and get them into the air, which could risk you getting exposed to it. So, and inhalation is what you want to avoid. Here's some more dangers of asbestos. Just many of the fibers will become trapped in the mucous membranes of the nose and throat, where they can be removed, but some may pass deep into the lungs or if swallowed deep into the digestive tract. And once they are trapped in the bodies, the fibers can cause health problems. Again, these are fibers that are up to 700 times smaller than human hair. These are fibers that you have to have a microscope to see. So once they're trapped in the body, it's very likely that they're there for the rest of your life. And asbestos is most hazardous when it is friable. This means that the asbestos is easily crumbled. It's easily crumbled, deteriorating, breaking down, and that releases fibers into the air. Spray-on asbestos insulation is highly friable. Asbestos floor tile is not. So if there's floor tile that contains asbestos, as long as it's not disturbed, your chances of getting exposed are very low, because it's stable. It's not friable. It's not going to easily crumble or release those fibers into the air. But that's not true for spray-on insulation. Is highly friable, so that stuff's easy to break down, which releases fibers into the air. Asbestos ceiling and floor tiles. Undamaged asbestos-containing ceiling tiles and floor tiles, laboratory cabinet tops, shingles, fire doors, siding, shingles, etc. will not release asbestos fibers unless they are disturbed or damaged in some way. If an asbestos ceiling tile is drilled or broken, it may release asbestos fibers into the air. If it is left alone and not disturbed, not damaged, nothing's going to happen. Because it's so hard to destroy asbestos fibers, the body cannot break them down or remove them. So, like I said earlier, once they're lodged into your lung or body tissues, they're gonna stay there, and that'll cause scarring, can cause illness, and then it can lead to a few other things. Here's listed the 3 primary diseases associated with asbestos exposure: asbestosis, lung cancer, and mesothelioma. Those are going to be your three most common or three primary diseases that are associated with asbestos exposure. So here are the different effects on your different body parts from asbestos exposure. Starting at the top left in the esophagus, that's where your cancer can develop from swallowing the asbestos fibers. And you can read some of the different effects from each of the different body parts. Again, heart, your blood flow to the lungs can be impaired and cause the heart to enlarge or fail. Your most common route, like we talked about earlier, is going to be inhalation or ingestion. So you're going to find it esophagus, lungs, down into your digestive tract. So first we're going to talk about asbestosis, which is a chronic lung disease which is caused by inhaling asbestos fibers. And prolonged exposure to these fibers can cause lung tissue scarring and shortness of breath. The symptoms can range from mild to severe, and they actually don't appear until many years after continued exposure. And there's no effective treatment for asbestosis. The disease is usually disabling or fatal. And the risk of asbestosis is minimal for those who do not work with asbestos. And it's rarely caused by neighborhood or family exposure. Asbestosis is going to be for the people who are around it for prolonged periods over many years. Some people who could be affected by asbestosis are those who renovate or demolish buildings that contain asbestos. They may have a significant risk depending on the nature of exposure and the precautions that were taken. Lung cancer is another bad thing that you can get from asbestos exposure. This causes the largest number of deaths related to the exposure of asbestos. The incidence of lung cancer in people who are directly involved in mining, milling, manufacturing, and different uses of asbestos and its products is much higher than the general population. The most common symptoms of lung cancer are going to be coughing and a change in breathing. Other symptoms include shortness of breath, persistent chest pains, hoarseness, and anemia. Going a little bit more into lung cancer, is people who have been exposed to asbestos are also exposed to some other carcinogens such as cigarette smoke, have a significantly greater risk of developing lung cancer than those who have only been exposed to asbestos. And one study found that asbestos workers who smoke are about 90 times more likely to develop lung cancer than people who neither smoke or have been exposed to asbestos. So mesothelioma is a rare form of cancer that most often occurs in the thin membrane lining of the lungs, chest, abdomen, and rarely but sometimes the heart. In the U.S., there's only about 200 cases diagnosed each year, and virtually all of those cases of mesothelioma are linked directly with asbestos exposure. Approximately 2% of all miners and textile workers who work with asbestos, and 10% of all workers who are involved in the manufacturing of asbestos-containing gas masks, they contract mesothelioma. So people who work in asbestos mines, mills, factories, and shipyards that use asbestos, as well as those who manufacture and install asbestos insulation, of course those people have an increased risk of exposure to asbestos, which then is an increased risk of mesothelioma. Some other people at risk for mesothelioma are those who live with asbestos workers near asbestos mining areas, product factories, or shipyards where the use of asbestos has produced large quantity of asbestos fibers that are airborne. Asbestos exposure can also cause other cancers. Again, those three that we just went over, asbestosis, lung cancer, and mesothelioma, those are the primary three but there are other cancers such as esophagus, larynx, oral cavity, stomach, colon, and kidney. Those can all be caused by ingesting asbestos. So some more asbestos-related illnesses and determining factors. The amount and duration of the exposure comes into play here. The more you're exposed to asbestos and the more fibers that enter your body, of course, the more likely you are to develop asbestos-related problems. While there are no safe levels of asbestos exposure, people who are exposed more frequently over a long period of time are at a much higher risk. Like we said earlier, smoking. If you smoke and you have been exposed to asbestosis, your chances are much higher to develop lung cancer than someone who does not smoke and who has not been exposed to asbestos. And if you work with asbestos or have been exposed to it, the first thing you should do to reduce your chances reduce your chances of developing cancer is to stop smoking. Age is another contributing factor, which causes of mesothelioma have occurred in children of asbestos workers whose only exposure were from dust brought home on the clothing of family members who worked with the asbestos. The younger people are when they inhale asbestos, the more likely they are to develop mesothelioma. This is why enormous efforts are being made to prevent school children from being exposed. In order to avoid being exposed, you must be aware of the locations it's likely to be found. And you typically aren't going to know where it is unless you test that material. If you don't know whether something contains it or not, just go ahead and assume that it does until you get it tested and confirm whether it is or not. And just remember that you can't tell if floor or ceiling tiles contain asbestos just by looking at them. This is something that you have to get tested to be able to know whether or not it contains asbestos. If you need to have materials analyzed or tested for asbestos, just contact the Physical Plant Action Desk at extension 47154, and definitely never try to take a sample yourself unless you're licensed to do so. Again, we're wanting to avoid disturbing those materials. If you disturb the materials that contain asbestos, that's what's going to release the fibers and expose you to it. So never try to take a sample yourself. If you've got a question about it, contact the correct people to come out and get your material tested at a laboratory so that they can tell you whether or not it contains asbestos. If you have a reason to suspect that something is asbestos, either because it's labeled, just do not disturb it. During the course of your work, if you notice that a material changes or that you become concerned that a material may contain asbestos, stop the work immediately and contact a supervisor. Stop your work, don't disturb it. If you're concerned about it, you need to get it tested before you do any kind of work on it. So how to avoid asbestos exposure? Just on those materials, never drill, never hammer. Just don't disturb the material is basically what you don't want to do. If you need to do work that might involve asbestos, check with the OSU Asbestos Abatement Department to find out what can be done for working around this safely. For example, before moving or removing ceiling tiles to perform maintenance work, it's necessary to ensure that they do not contain asbestos. And if they do, they'll need to be removed by a licensed asbestos abatement worker before you can get back in there and do your work. Some housekeeping. Housekeepers and custodians should never sand or dry buff asbestos-containing floor tiles, and only wet stripping methods may be used during stripping operations. The wet stripping methods are going to put the water on the asbestos fibers or it's going to keep those fibers from becoming airborne with the wet stripping methods. And then low abrasion pads should be used at speeds below 3,000 or 300 RPMs, excuse me. Broken and falling ceiling tiles should be left in place until identified. And they may only be removed after it is verified that they're safe. And then broken and damaged asbestos floor tiles may also be, or must also be removed by OSU asbestos abatement workers, excuse me. And if you think that there's a damaged asbestos containing material, for example, if you discover some asbestos that has been knocked off of a ceiling or wall, this would be considered a spill, or an asbestos spill, and that would need to be cleaned up immediately. And do not attempt to clean the spills yourself. This needs to be done by asbestos abatement workers. Report any damaged pipe insulation, ceiling tiles, 9-inch floor tiles, fallen clumps of sprayed-on insulation. Those are the kind of things that you're going to want to report immediately, and don't clean them up yourself. And take measures to prevent others from disturbing the spill. If it's in a room, maybe lock that room, put a sign on the door to stay out. And by knowing where asbestos is likely to be located, and then taking measures to not disturb it, you will protect yourself and others from exposure to the hazardous substance that asbestos is. So here are some of the takeaways from today's training. We talked about what asbestos is, what it looks like, what the most common types are, where it's located, where you can look for it, or where you can find it, some health effects of asbestos exposure, some general housekeeping, and then what spills are, what to do whenever you find a asbestos spill. So here are some questions that we added on here. How do I know if I have asbestos in my home? Floor tile, ceiling tile, shingles, siding. Like we've talked about, you can't tell from looking at it. The only way to be sure whether or not a material contains asbestos is to have it tested by a qualified laboratory. And next question here is, what are the health risks if I have asbestos in my home? If it's undisturbed, and if that asbestos containing material is in good condition, it's not deteriorating, and you're not working on it, you're not disturbing it, it's unlikely to present any health risk. And the risks from asbestos occur when it is damaged or disturbed, and that's when the asbestos fibers become airborne and can be inhaled. So here at OSU Environmental Health and Safety, here's a list of our programs and services. If you'd like to look at those or have any questions, please feel free to reach out to me. My name is Cooper Duke, the Occupational Safety Coordinator. Here is the number to our office. You can also reach out to us by email, and then we're located in UHS Suite 002, which is in the basement, and there is our website, ehs.okstate.edu. Thank you very much.